Hello everyone, my name is Juan Castillo and today I will be talking about corticosteroids. Starting off, some of the general names for corticosteroids are prednisone, hydrocortisone, and methylprednisone, while some of the brand names are deltasone, orasone, and meteral. During my research, I came across dozens of different names, but these 6 names were some of the ones that popped up the most out of all of them. The next thing I want to discuss is why someone would use corticosteroids. As you can see in the presentation, I have provided 3 pictures. One of a person with a rash, another of a child having an asthma attack, and the last one of a man having arthritis pain. Corticosteroids also treat inflammatory bowel diseases such as Crohn's disease. The one interesting thing I wanted to point out is that corticosteroids come in many different forms. For example, for the rash, it could be found in an ointment. For the child having an asthma attack, they would need to use an asthma pump. And for the man having arthritis pain, he would either need to use an injection, capsules, or tablets. Later in the presentation, I will discuss some of the side effects because each of these have their own specific and unique side effects. Now, some of you might be wondering how corticosteroids work and how is it that they're able to treat asthma, rashes, and arthritis. Well, the answer is simple. It reduces inflammation. The way it reduces inflammation is when somebody takes a corticosteroids, it mimics the effect of cortisol in their body. Now, cortisol comes from the adrenal glands, and when our body has higher levels of cortisol, that's when we're able to reduce inflammation. Now, I have provided a video below basically giving you a better breakdown of how corticosteroids work and how they interact with the body. Please start the video at 34 seconds and stop it at 4 minutes and 30 seconds. Moving on, I want to discuss how corticosteroids affect our digestion, absorption, and metabolism. So when we take a corticosteroid, it affects our absorption and digestion of the vitamins and minerals that we need in our diet, such as vitamin A, C, iron, and zinc. But most importantly, when we take a corticosteroid, we develop a severe chance of becoming deficient in vitamin D while also gaining a calcium malabsorption. Now, this isn't good. You don't want to be deficient in vitamin D and calcium because if you're deficient in calcium, you gain a risk for osteoporosis and brittle bones. Moving on to the metabolism, when you take a steroid, your body tends to want more energy because you're taking a steroid. So this causes you to have an increase in appetite or an increase in food cravings, which ultimately makes you gain weight. And obviously, if we want to keep a healthy diet, we aren't trying to gain weight, we're trying to keep a stable, healthy weight the whole time while we take a corticosteroid. Corticosteroids interact with drugs such as erythromethylcyan and clarithromethylcyan, and these drugs reduce the ability of the liver to break down corticosteroids, while drugs such as Ashland and phenobarbital increase the liver's ability to break down corticosteroids. Also, it is recommended that you don't eat any form of grapefruit while taking steroids because they reduce the effect of corticosteroids as well. Moving forward, some of the side effects of corticosteroids include stomach ulcers, gastrointestinal bleeding, insomnia, fungal infection in the mouth, which is from the asthma pumps, elevated blood sugar and blood pressure, while also causing red skin and acne, and that's from the topical cream that you apply if you have a rash, while also having a loss of color in skin and intense pain if you get the injections. Sometimes it does cause memory loss and confusion and delirium as well. Next, I will be examining how registered dietitians correct or prevent some of these consequences. They would recommend that their client eat a healthy diet while participating in physical activity to maintain a healthy weight and to strengthen their bones and muscles. Registered dietitians would also recommend that their clients take a calcium or vitamin D supplement or a multivitamin to prevent those vitamin and mineral deficiencies that their clients might come across. They will also examine the dosage that their client is taking. If that dosage is too strong and creating too many side effects, they might think about moving them to a different steroid or bumping down their dosages as well. Some simple advice I would give to someone before taking a corticosteroid would be for them to eat a complete diet, for them to take a multivitamin every day to reduce the risk of deficiency, and if they don't want to do that, then at least take a vitamin D or a calcium supplement. They should also be aware of the dosage that they're taking and for how long they're taking it for. And lastly, I want them to be aware of the side effects that come with this medication, and if they are suffering from any of these side effects, to get off the medication and to contact their doctor immediately. These are my references, and thank you for watching my presentation on corticosteroids.